Okay. All right, everyone. Welcome to another installment of Medicare Hospital Benefits through Norwescap. And our presenter today is Lisa Pino. And Charles Clarkson will answer any questions that you may have. This is being recorded and will go on our YouTube page if you somehow missed this or came in halfway. The other thing I wanted to tell you is that we also are doing a program on September 9th. That one is Medicare and senior scans. So we hope that you will go on parsippanylibrary.org and sign up on the calendar. Lisa, take it away.
Right. Thank you. Again, my name is Lisa Pino. I am from Norwescap. Our office, one of our offices, is located in Rockaway, New Jersey. And I'm the Medicare coordinator and Medicare counselor for the Morris County location. And this is about hospital benefits today. And the full hospital benefit idea is that if you have Medicare Part A and Part B, you can receive the full range of hospital benefits. They do work together to provide you the most coverage. However, you do need to be warned. Are you an inpatient or outpatient? Just because you stay overnight in the hospital does not mean that you are an inpatient. You need to ask, but they are supposed to tell you. You actually are supposed to get a piece of paper that states whether or not you're an inpatient or an outpatient. If you do not receive this, please ask for it. Part A inpatient coverage usually covers your room, your meals, nursing care, therapy, lab tests, certain medications, and other services and supplies that are related to your condition. Now, the term medically necessary and reasonable costs are covered. That is determined by Medicare. And most insurance companies have that phrase in there anyway as well. Part B hospital coverage covers part of your doctor services while you're an inpatient. And it also covers outpatient services. So this means you will pay a copay for each individual outpatient service that you receive. Benefit periods. Many people do not understand this. It can be very confusing. So I'd like to explain that a little bit. Medicare measures your use of inpatient hospital services as benefit periods. It begins the day you're admitted as an inpatient, and it ends when you don't have any hospital stays for 60 days in a row. So an example is Joe is admitted for a heart condition. He's discharged 4 days later. He's again admitted for complications from diabetes 2 weeks later. Now, he is still in that same benefit period, even though he was admitted with 2 different conditions. The conditions don't matter. It's the benefit period. If you're admitted 60 days, within a 60-day period, twice, 3 times, whatever it is, you're still in that same benefit period. What do I pay for these benefit periods? Well, you pay a one-time deductible for each benefit period. And in 2021, the deductible is $1,484 for the year. Most Medicare supplemental plans assist with these hospital costs. So if you have a supplement plan, whether it's a Medigap plan or a Medicare Advantage plan, they work with your Medicare hospital benefits to provide the most coverage for you. And the benefit periods are as follows. Days 1 through 60, you do not have any coinsurance. 61 through 90, $371 per day, and days 91 and beyond are $742. Now, beyond that, you're responsible for all costs. But again, if you have supplemental coverage, that should help with this as well. Now, you also pay your Part B deductible and 20% of costs for doctor services. Again, a Medicare supplement helps with that as well. What Medicare Part A does not cover? It does not cover the following: private duty nursing, a television, a telephone in your room, a private room unless it's medically necessary, personal items like toothpaste, mouthwash, things like that. If you are an outpatient, Medicare generally does not cover prescription drugs that you could self-administer. In other words, if you are on blood pressure medication and you go to CVS to get that and you bring it home and you take that, that's considered a self-administered drug. However, if you're having surgery, any drugs that are admitted during your surgery through an IV would be covered under Part B because you were admitted either as an inpatient or an outpatient for this surgery, and that drug through the IV is related to that, and Part B will pick that up. But any drugs that you pick up at your local pharmacy are considered self-administered, and that goes under your Part D drug plan. That is separate from whatever you get taken in the hospital. So now there are certain circumstances where a drug that you normally self-administer can be covered under your hospital benefits. That's on a case-by-case basis, but you will be able to find that out at that time. Doctor services are not covered under Part A. Again, they're covered under Part B. Discharge too soon. Sometimes this is a problem. I have a few clients that have called me in the past about this. If you're in a hospital and you feel that you are being discharged too soon, you do have the right to an immediate review by the Beneficiary and Family-Centered Care Quality Improvement Organization. Within 2 days of admission and prior to your discharge, you should be receiving a notice, an important message from Medicare about your rights. It will list your particular contact for this particular organization that's closest to your area. And if you do not receive this, ask the hospital for it. They are required to give it to you. You can contact this organization and they can help you with this process if you feel you are being discharged too soon. They will actually review your case. Emergency room benefits. Now, Part B covers emergency room charges because you're an outpatient, unless they decide to admit you from the emergency room. Then Part A will cover that portion as soon as you're admitted. As I said, drugs will usually be covered by your Part D drug plan. It depends on the plan that you have and what is being administered. But you will have coverage. It just depends on what part of Medicare is going to cover that particular drug or drugs. Important, please, if you know you're going into the hospital for a procedure in advance, bring all of your health coverage cards with you, including your prescription drug card. You will need that as well. Keep them in your wallet if possible. However, don't delay going to the emergency room just because you don't have your cards with you. You can provide that with them later. They will not deny you care just because you don't have your cards with you. And it's a good idea to always have an updated list of drugs that you take with you in your wallet. And you probably should provide one to either a family member or a friend or caregiver, whoever your emergency contact is. So somebody is aware of what you're taking and can provide that to either the 911 medics, the emergency room itself, anyone who is required to give you care. Discharge plan. You should probably have one. You can't always do that in advance. I understand that. But while you're in the hospital, usually they tell you what to plan for, what your recovery is going to be like. So update your drug list. Do you have any new meds from your hospital stay? Make sure you update that as soon as you're able. Make sure you have transportation home and a caretaker at home if needed, and that you have medical care instructions and that they are clear. Please ask questions. I cannot stress that enough. You need to make sure you take care of yourself and you know how to do that, and that any caregiver you have knows how to do that as well. Speak to the hospital social worker if you are concerned about your costs. Many people don't know that this is available to them. Help is available if you cannot pay your medical bills or you're concerned about it and you're not sure if you can pay them. You ask to speak to the hospital social worker, tell them that you're concerned about paying your bills. They will come up and they can help you apply for programs specifically for Medicare, if you're on Medicare, that can lower your costs and help pay some of that for you. Make sure you receive written discharge instructions, and especially for your prescriptions. Many doctors will write, take as directed. It's very difficult to remember exactly what that was. You're bombarded with so much information. I highly recommend that you write it down or have someone write it down for you so that you can remember this information when you get home. And last but not least, if you need any assistance before you go into the hospital, while you're in the hospital, please call us. Our website for information is www.norwescap.org. And our main number for any Medicare or disability or aging assistance is 973-784-4900. You will be directed to a counselor in your area in Morris County. So you can go for in-person counseling. We are now open for that. But if you're homebound or not comfortable with that for any reason, we still do Zoom, FaceTime, we do phone consultations, whatever you're comfortable with. You can contact us with any Medicare questions. We assist with all parts of Medicare and Medicare assistance programs. So if you right now, you don't have to be in the hospital. If you are having trouble paying your bills now, or you have a loved one who is, call our office. We can assist you with the application process or them with the application process to apply for programs that can help you out. We can even screen them over the phone. So you don't have to waste your time filling out an application if it doesn't apply to you. I think that covers all the general information, but I do encourage you, if you have any specific questions, concerns, if you're just curious, if you're new to Medicare, please contact us. We do help people sign up for Medicare who are new. If you just want to review your policy, especially during open enrollment that's coming up this fall, please let us know. And thank you for listening.
And I want to add something. You talked about being an inpatient compared to being an outpatient. And I want to just emphasize why that's so important. You know, a lot of people discover that they go into the hospital and they're considered an outpatient or on observation status, and they go to rehab after the hospital stay, and they find out, oh my God, I didn't have a 3-day inpatient hospital stay, so now my rehab is not covered. So that's very important why you need to make sure you're an inpatient, because there are certain rules in Medicare, such as rehab, and you must have 3 full days, you know, as an inpatient hospital in order to get the first 20 days of rehab for free. Also, if you do go to rehab after you come out of the hospital, do not fall for them telling you, well, you know, you can't really improve and therefore we're going to stop providing the services. There's been a lot of litigation called the GIMO case, GIMMO, which says there's not an improvement standard for getting rehabilitation. As long as it prevents you from going backwards or just maintaining your condition, that is acceptable for Medicare and you should be covered. I've had a number of people who complained that their rehab session, they were told, you're not improving, we're no longer going to provide the service. And that is a no-no under Medicare rules.
Good point.
And by the way, I'm Charles Clarkson. I'm with the Senior Medicare Patrol in New Jersey, and we help Medicare beneficiaries fight fraud, waste, and abuse on Medicare. And you could always reach us. Just look up Senior Medicare Patrol. And we do have a website called Senior Medicare Patrol NJ.org. No spaces, no dots. Senior Medicare Patrol NJ.org. Thank you.
Okay, that's the end of our program. Lisa and Charles, we really appreciate your time and all of this great information. Again, this will go up on the Parsippany Library YouTube channel. So, and we'll see you all in September. Thank you both very much.
Thank you.
Bye-bye.
Bye-bye.